Now to the growing Ebola crisis. While doctors here have just had some success treating the deadly disease, the virus does continue to march relentlessly across parts of Africa. Our chief health and medical editor, Dr. Richard Besser, has made a return trip to the hot zone in Liberia to see what it will take to stop this deadly outbreak. And good morning to you, Dr. Besser.
Lara, there have been outbreaks of Ebola for nearly 40 years, but none has caused the devastation they're seeing in this one. I went to the country's largest hospital to see the heroic efforts underway to save lives.
This morning, a look inside the hot zone, a makeshift Ebola clinic at the epicenter of a global health emergency.
It used to be used for treating people with cholera, and now it's Ebola.
Opened just 9 days ago, it's now at full capacity. Nearly 60 Ebola patients, many without beds to sleep on.
Highly contagious, highly infectious, very dangerous.
We suit up in full protective gear and go inside a triage unit, a highly infectious area where suspected Ebola cases first arrive.
They're assessed to see could they have Ebola, and if they are, they're put into isolation.
Just outside the scene is apocalyptic, a courtyard where Ebola patients sit and wait. Some are confirmed cases, others just waiting to be tested.
This is one of the most important places in the Ebola treatment unit. It's where the healthcare workers, when they come out, get sprayed down and they take off their protective gear.
For healthcare workers here, there are many challenges. They desperately need more resources, more beds, and more protective gear.
Are you worried being in the hospital, taking care of Ebola patients?
Indeed, we are worried. But we got to come, because if we all sit back, there will be no one to care for our brothers and sisters.
It has been torrentially raining here in Liberia, which is adding to that feeling of global isolation. Many airlines have canceled their flights in and out of the country because of the fear of Ebola. While it was easy to get in here to report on this story, it may be difficult getting out.